confidentiality is a very important part of our code of ethics, because what we are saying with confidentiality is that we are establishing ourselves as professionals. So when any of us goes to see our healthcare provider, we're going to share things with that provider that we wouldn't share with any other service provider, right? So a healthcare provider is a person who we pay for to receive a service, right? The service that we receive is a very personal service. We're talking about our bodies. We are also talking, when we are talking about our health, we also have to end up discussing things like our habits, our diets, and our histories, our social histories. So it is very private. And so when we go see our healthcare providers, we understand that we are going to be sharing very personal information with them. And we do that because we know that it is a professional responsibility to not share that information for things other than our healthcare, bringing us service in healthcare. And that is the case also for healthcare interpreters. When you take a look at the Code of Ethics, you will see that there are several Code of Ethics that are put in place by different organizations, by different associations, but you will see that the main points of the Code of Ethics will remain the same. They are just phrased differently, right? And so when we're talking about confidentiality, you can see that confidentiality in this case is usually always at the top because it is very important. And the definition of confidentiality, whether you are looking at the Code of Ethics that is written by CHIA, which is the California Healthcare Interpreters Association, or NCIHC, which is the National Council on Healthcare Interpreting, or IMIA, which is the International Medical Interpreters Association, you can see that confidentiality is always number one. Confidentiality is very important because of the types of things that we are sharing during these encounters, or we're sharing with these professionals. But it is especially important for healthcare interpreters because as healthcare interpreters, we have already discussed that our profession is pretty young, and a lot of people don't really know. A lot of the folks that we bring services to, a lot of those patients or clients that we are interpreting for, the LEP population, they don't know our role, our defined role as well as we do. A lot of professionals don't know it because our profession is so young. And so while we understand it, and as professionals we're going to abide by it, we are also sort of burdened with having to let other folks know. A doctor doesn't have to go, when you go see a doctor, they don't have to say, okay, before I examine you, I want to tell you that everything is confidential, because it is something that we already know as a society. Throughout history, we know we can expect that. But interpreting being a newer profession, we do have to sort of make it explicit. We have to say it, but in addition to saying it, we also have to inspire it. What I mean by that is we also have to behave in a way that we show with our behavior that not only are we saying it, but we actually mean it, and it is part of our profession as well. You can see in the presentation here that I have also written under confidentiality the right to privacy. And the right to privacy has to do with confidentiality, and it also, very important thing that you should know, also means that there is a law behind it. That law is known as the HIPAA law, which protects patients, service recipients, their right to privacy and confidentiality. So it's not only part of our code of ethics, it's not only part of a healthcare provider's code of ethics or doctor's code of ethics, but it's also a law, and it's a federal law. The name of that law is known as HIPAA, We are not going to go too deeply into it right now, but we will go into it more in depth in the future, because it is something that you are going to be responsible for abiding by as you work in healthcare, and as you work as an interpreter. And I've also typed the word confidence. And so, as I mentioned, our demeanor, our attitude, our behavior when we are working as interpreters has to be one that inspires a person to believe that you are a professional. Because if I go in there and I say, hey, I have a code of ethics, I'm a professional, I'm going to charge for this, I'm getting paid for this work that I'm doing, and I come in with an attitude that is not professional, treating someone with disrespect, not taking my job serious, then what I am saying doesn't match my behavior, and then it's not going to be believed, right? So we have to inspire confidence in the fact that what we are saying we are going to do, we'll actually do. It's going to be also very important for interpreters, because a lot of times you will note that sometimes patients, because they're used to sharing things with doctors and nurses, they'll feel comfortable with sharing it, and maybe not necessarily comfortable, but they will accept the fact that they have to share this information in order for their health, more so than they would with another person being in the room, and that other person, I mean the interpreter. A lot of times, because of culture, because patients might automatically feel closer to you because you share a language, because you share a culture, they might feel a little bit more shy or be a bit more reticent to share information because we are there. And that's going to make it super important for us to show ourselves with our behavior as professionals, so that we try to shift the mindset of the patients to see us just as they see any other healthcare provider. And again, another thing that makes it especially important in healthcare interpreting is that when we are talking about smaller communities, or even large communities, it's at least perceived likely that we might know the patient or might know similar people, and that makes it difficult for these patients to want to share information. It's one of the things that also we have talked about makes it difficult for patients to discuss certain things in front of family members, right? Now, I'm not saying that that's how they're going to see you, but it's going to still be a little bit of that feeling of, I might know you, you might know someone I know, this information that I'm only sharing because of my health, and I know that I can share it with a healthcare provider, but here's now another person, another interpreter who might know someone I know because we speak the same language. Should I feel comfortable sharing that information? And so we as interpreters, we have to, again, with our behavior, let patients know that they can share that information. And the other thing I want to say about confidence is also when we are practicing, we need to be confident that we can interpret, because if you look like you're getting confused or overwhelmed or you're scared while you're interpreting, then neither party is going to feel like there is a accurate interpretation going on of what they are saying. So this is another thing that we need to be conscious about when we are interpreting, when we are working, and our presence, right? So professional in the way that we are following a code of ethics, protocols, standards of practice, but also confident in our skills, because if we are not confident in our skills, then those folks who we are bringing services to are not going to be confident in our skills either. Okay, so I think I've sufficiently covered that. I'm going to move on to transparency. And what is meant by transparency, the concept of transparency, a concept that has a lot to do with accuracy and completeness. It also has a lot to do with autonomy. What we mean by transparency means that the interpreter is not going to keep or hide any information from either party. So for example, if a provider says something, then the other people in the encounter, whether it be the patient or the patient's family, any other person in the encounter is going to also receive that information. So if the doctor says something like, "I'm not sure why I cannot see your past medical history," then, and that's said in English, then the interpreter is going to interpret everything so that everyone in the encounter has that information. So that's transparency. The interpreter is not hiding anything. Let's say the patient then says something like, "I knew this doctor wasn't good. He doesn't even know how to work on the computer." Well, last week we said that interpreters interpret everything when we were talking about accuracy and completeness, even if it's rude, right? So if the patient says that, then the interpreter is going to interpret that to be sure that she doesn't hide anything, right? So she's being transparent. She's not going to hide anything from anyone. So that's what transparency means. And then the next one is assignment. Assignment is, and now before I move on, I just want to say that one of my pet peeves as a professional interpreter, as a trainer, and as a professor is when I hear interpreters call their assignments appointments. And you'll see why. An assignment is a task that is assigned to a worker, right? So an assignment is, for example, there is an appointment for a patient and that patient doesn't speak English. That patient speaks Farsi. So that interpreter is going to be assigned to be an interpreter during that encounter so that the patient can communicate with their provider during their appointment. So that is an assignment to you because you are going to be working, right? It's a task as a worker, as an interpreter, that you are going to complete because that is your job. And appointment is going to be what the patient is going to call it. So the appointment is for the patient, the assignment is for the interpreter. Okay? So be sure that you understand the difference between those two. So an assignment, you're the interpreter, you're an employee, you're a provider. So you are going to be working an assignment while the patient is at their appointment, which is a time assigned for them to receive service, right? Okay. And then pre-encounter, which is part of what you will learn and read about in section 2.1 of your textbook. A pre-encounter is what interpreters do before an assignment. The beginning of your assignment begins with a pre-encounter. That's when you receive all of the information that you need in order to be present at the assignment and do your job. Now, it's a little bit tricky because sometimes most of us would hope to get more information than we actually get. In reality, we don't get as much information as we would love to get to help us prepare. So what would be perfect for us to receive would be, yes, the location, the patient's name, what the patient, the department where the patient will be seen, which is, again, part of the location, and what the patient is going to be seen for. That way we could prepare for the type of vocabulary that we're going to encounter, right? But the reality is that a lot of times we will not get this information. Actually, most of the times we will not get this information, again, because that information is going to be private information. And a lot of times when an interpreter is requested, it's done over the phone or it's done online. And so providers and interpreting services managers don't want to share that information over the phone or online because it is information that by law is meant to be kept private, and so they try not to pass that information along or reduce the amount of times they pass that information along, especially when it comes through internet or over the phone, which are ways that hackers can get into information or information can be leaked. So for protection, a lot of times we don't get that information. Now, what we do receive is information about the location, and that's how we can know at least a little bit and prepare at least a little bit for our assignments. So for example, I might be told it's going to be in the adult medicine department. Okay, that doesn't give me a lot of information, but at least I know that it's an adult. And another thing that I might know about adult medicine is that it is not an emergency department. It's not going to be a surgery. It's not an assignment that has to do with pregnancy, perhaps, because if it were, then it would be in obstetrics. And other times, just the department can give us a little bit more information. So for example, dermatology. Okay, so now I know it's going to be something that has to do with the skin or skin conditions. If it's, for example, at the cancer center or oncology in this department, maybe I may not know exactly what kind of cancer it is, but at least I know that I narrowed down a little bit more so in knowing that it has to do with oncology or cancer. If it's at cardiology, again, I have narrowed it down to have to do with the heart, and I'm going to prepare with that vocabulary. Now, this is yet another reason why we learn about medical concepts in interpreting, because if you noticed in the last module, I gave you a chart from the CDC that shows the top 10 causes of death for men, right? And so as you go along, when we are talking about these health topics, we will discuss, how common certain things are, and you will sort of get to know a little bit about what kinds of conditions to expect more likely. If you go, for example, to endocrinology, then you will, to the department with endocrinology, then you will see that most of the times it's going to be about diabetes because that's more common. If you go to cardiology, then heart attacks, hypertension, things like that. So even if we don't tell you exactly what the patient is going to be seen for, you can get ready with the vocabulary that's related to cardiology, and then also start thinking or preparing yourself based on your previous knowledge of, okay, these are the things that I have seen more often when I go to cardio, or if you're a new interpreter, these are the things that I learned that are or the conditions that I learned are most common reasons that patients go see a cardiologist. All right, that all takes place during the pre-encounter. The actual encounter, which is the meeting, right? So the term, generally speaking, the term encounter means meeting or making contact with someone, right? Coming into contact with someone. With interpreting, what we are going to look at now is what happens during an encounter. So what is our job during an encounter? Well, of course, we know that interpreting is going to be our main job, but what we are learning here is how that actually takes place, right? So we're going to look at the professional introduction, which is also known as a pre-session. We're going to take at how interpreting happens. We're going to take a look at intervening and mediating when it's necessary. So these are the things that happen during the encounter. Okay, so you heard me talk about things that happen during the pre-encounter, like getting ready, getting information, things like that, preparing. So the things that happen during an encounter are meeting folks, right? Doing a professional introduction, or a pre-session, known as a pre-session as well, interpreting, and then intervening and mediating when necessary. So those are the things you're going to have to know how to do in order to work the encounter. Okay, so your book talks about 3 stages, which is the pre-encounter, encounter, and the post-encounter. So what that looks like practically, you are told, okay, you need to be at Kaiser in Roseville at 3 o'clock for a patient's appointment, and you're going to be interpreting for someone in the obstetrics department, or OBGYN, which is obstetrics and gynecology. So if you are an in-house interpreter, which means you are an employee of Kaiser, you will most likely have a schedule that shows what time you have to be there and for how many assignments during the day. So you'll have an agenda. In some hospitals, they actually have a queue where somebody sort of shows up and they didn't know there was an interpreter that was going to be necessary. Then they will, there's sort of like everyone's in line, and they look at, okay, who is not doing anything and who's first in line that doesn't have an assignment right now or isn't with a patient right now, and that person will go. For freelance interpreters, or for interpreters who work for employees of a vendor, they are going to be told ahead of time, usually a day or more ahead of time, where they need to be. In healthcare, it's going to be very important that we understand, regardless of our culture, the rule in healthcare is that early is on time and on time is late, and late is unacceptable. We have to usually be 10 to 15 minutes early. So if we are told our assignment starts at 9, usually what that means is that the patient's appointment starts at 9 as well, which means we have to be in the office at 8:45. So in the location, right, in the clinic, wherever this patient is going to have their appointment, we need to be there 10 to 15 minutes ahead of time. This does not mean in the parking lot. This does not mean rushing in. It means our body is at the location 10 to 15 minutes before the assignment starts. Another reason why this is important is because sometimes there are lines where you can need to check in. If that is the case, then you have that 10 to 15 minute cushion. Another reason why that might be is sometimes patients are told to check in one department, but go and wait for their provider in another department. So we need to have that cushion. Another reason why we need to be there as well is sometimes patients are told to arrive early to start completing paperwork. And so we also need to be there to assist with that. And we'll see how that happens. Okay. Now, as far as how you bill for that, that's going to be something that you have to talk with your employer about. So typically, if I arrive at 8:45 and I start interpreting right at 8:45, or even start completing paperwork with the patient or assist the patient with interpretation to register or check in with the front desk, that's the time that I can say I started working. So when I am billing or when I'm getting paid, I'm going to say my time was starting at 8:45, right? Sometimes it doesn't immediately start at 8:45, let's say, or 15 minutes ahead of time. You arrive and there's nothing to do. That's fine. You're still expected as a professional to be there at that time. Now, I want you to think of this as, for example, let's say that you are a receptionist, or you are you're the nurse, you are the doctor. If your shift starts at 8 o'clock, right, you're not going to arrive at the clinic right at 8 o'clock. At 8 o'clock, you need to be ready to start working, right? So that means that you're going to arrive ahead of time to put your stuff down, turn on your computer, do whatever it is that you need to do for your job so that at 8 o'clock you're ready to start working. So it's the same concept that we are used to with other jobs. At this point, I feel like I need to back up a little bit to the pre-encounter. I did skip a slide here. So we talked about HIPAA, and HIPAA begins with receiving information as to where we're going to go. Even that information we can't share, right? I feel like I have to back up because I do want to make sure that we understand that our schedule is going to be important. We cannot be late to assignments. We have to prepare with arriving on time and early to think about things like parking, and access to buildings, right? Especially if we don't know where this assignment is going to take place or we've never been to the location. So with the pre-encounter, part of preparing, which is something I didn't mention, is your attire, what you're going to wear. So your attire is going to be very important because, again, working in healthcare is not going to be like working in maybe other jobs that we have had. Our attire, the way that we dress in healthcare is very important because it is going to be one of the ways that we take safety seriously and we abide by safety rules. So when you go to interpret medical setting in a healthcare setting, you always have to have closed-toe shoes, non-slip shoes as well. So no flip-flops, no sandals. And again, this is for your own safety, but it's also for the safety of others. Slip shoes, non-slip shoes are going to be very important. And that's another way, it's an easy way to see how it's, yes, to take care of yourself so that you don't slip and fall and hurt yourself. But you also, if you were to slip and fall and bump into someone else, now you're affecting someone else's safety, or someone might trip on you. That's you affecting somebody else's safety. So safety is going to be very important, and that's another thing that you have to plan on as part of the pre-encounter. Your name badge. So in whether you are an employee or you are an employee of the hospital or an employee of a language service provider, a vendor who brings services to a clinic or hospital, or you are a freelancer, you will always have to carry a badge. You will not be allowed to come in and work, complete an assignment, unless you are carrying a badge, right? It's part of how we identify ourselves as professionals as well. So let's go back to the encounter, back to checking in. Okay, so when we check in, we are going to go directly to the front desk. We're not going to try to speak to the patient first. We're not going to look around to see if we find our patient first. What we are going to do is we're going to check in with the receptionist or the front desk, whatever setup they have. If there is a long line, let's say that you arrived 15 minutes ahead of time, but the check-in is really long, and there is a long line and it's sort of getting close to the start time, what I recommend and what I have done in my experience is I will go to the person who is next, say something like, my name is Yenny. I just need a very quick moment of the receptionist. I'm not a patient. Would you mind if I went ahead of you just to let the receptionist know I'm here. I promise it will not take long. Usually that has worked for me. I want to be sure that I'm polite and that I take into into consideration that maybe if I've been waiting for a long time, that means that this person has also been waiting for a long time. So I want to let them know, because I'm going to cut in front of them, right? Essentially is what I'm doing. I will say to them, it's not going to take very long. I just want to let them know that I'm here to work. And I usually am able to get in on time if there is a long line. Now, that doesn't mean that if your patient is there, that doesn't mean that you can bring them to the front and speak and cut in front of this person who is next. If the person is there, then you will ask that person to get back in line, ask your patient to get back in line, and then when they are up, then you will assist them with registration. Doesn't mean that you let the patient that you are there to interpret for cut. But it is very important that as the time approaches that you let someone know that you're there, because sometimes if the patient has arrived before you and the clinic or the provider that they're going to see is running early, they might take them to the back without you, and that's just a reality. They should not do that, but sometimes that happens, and so you want to let the receptionist know as soon as possible that you are there. Okay, so many times what will happen is, okay, you come in because you were 15 minutes ahead. There's only 1 or 2 people ahead of you. It's fine. You don't have to cut in front of anyone. You'll arrive and you'll check in, and you will see that in the video, and you're going to watch a video that you've watched before, but this time I want you to pay attention to these things. I want you to pay attention to how the interpreter checks in, what she says to the receptionist. What happens next is that sometimes your patient, because you are arriving early, the patient is not there yet. So what you'll have to do is you'll have to let the receptionist know. As you watch the interpreter check in, I want you to watch her introduce herself and let the receptionist know why she's there, who she's there to work with. And then you'll notice that in this case, the patient has not arrived yet, and so she is told that she has to wait, and the interpreter then says that she is going to be waiting in a certain spot so that the receptionist can let her know when the patient has arrived. You're going to let the receptionist know, I'm going to stand over here. When the patient comes, then please let me know so that I can come and assist them and you with the registration process. So I'd like you to pay attention to that as you are watching this video. Now, if the patient has arrived, then you are not going to go search for the patient. You're going to ask the receptionist to call them up to the front if they need assistance with registration. And so you're going to assist them with registration. Another thing that you will need to remember is that you may be asked to help the patient complete some paperwork or questionnaire before they get started. And this is something that most of us have gone through when we have gone to our own appointments with our providers. And so when you do that, you need to be sure that you are going to be doing it in the lobby where there is another provider. Because as we will discuss next, interpreters should never be alone with the patient. So in this case, your provider is going to be the paperwork that you're completing, but another person needs to be present. So you're going to do that somewhat close to, or as close as possible to, the reception area, the receptionists. And then what you're going to do is you're going to complete it and then follow the instructions. If the patient was told complete it and hang on to it, give it to the MA or the provider, then you're going to give it to the patient to have, and they're going to be the ones who are going to keep it and to give later to the provider. If you complete the paperwork and the patient's still not has not yet been called, then it's very important that you don't sit with the patient. You're going to let the patient know and say, okay, so hang on to this, and I will sit over here. So you're going to sit away from the patient. When they call you to go back to the provider, to see the provider, I will accompany you. But it's very important that you understand that you cannot sit and chat with the patient, okay? So now, if the paperwork was meant to be completed and then returned to the receptionist, again, you're going to give it to the patient and say, okay, this is complete. Let's go give it to the receptionist. I will interpret as you submit it back to the receptionist. But again, part of that patient autonomy is this is the patient's appointment. It's not the interpreter's appointment. This is the patient's paperwork, not the interpreter's paperwork. So you're going to hand that back to the patient, and the patient will be the one who will submit it to the receptionist or hand it back to the receptionist with your linguistic assistance, with your interpretation. Then usually what happens again is that that patient is going to be called back, and it's going to be called back by an MA. Depending on the type of assignment, most of the times an MA, which is a medical assistant. Sometimes it might be a social worker or a case manager, but usually it's going to be an MA. And in this case, what you're going to do is when the patient's name is called, you are going to follow the patient, and you're going to let the MA know that you are the interpreter. And you're going to also let the patient know that that's what you said, right? Because we already discussed transparency, right? So as you approach the MA, you're going to say, good afternoon, my name is Yenny. I'm the interpreter assigned to this appointment, or I'm the interpreter assigned to Mr. So-and-so's appointment. And then you're going to let the patient know. The interpreter was letting the MA know that I'm the interpreter. Okay, so then they can start the whole process, right? Usually the patient is asked to step up on a scale, their blood pressure is checked, their temperature is checked, things like that. They're asked questions like, do you know approximately how tall you are? Sometimes they are asked to verify their first and last name. Sometimes they're asked to verify their medical record number. And again, you're going to be assisting during this process. Now, the next point that you see here in my presentation is position. So when it comes to positioning, if you take a look in your book in section 2.2, you should read about where the interpreter should stand when possible. Okay, and what we're looking at is having the best position where the provider, in this case the MA, can speak directly to the patient and vice versa, where we are not in the way and we are not disrupting the MA while she is doing all that she does, like taking the blood pressure, temperature, and things like that. And usually that means that we are on the side of the patient, slightly behind the patient, right? Okay, so then when the patient is taken to a room, typically we call this roomed, the patient is roomed, they are taken to the room where they will see the provider. The MA is going to step away typically, and then when they've stepped away, they are going to tell the patient that their doctor is going to be coming soon. You heard me say that an interpreter should never be alone with a patient. This is going to mean that if the MA steps out and the patient is supposed to be waiting alone in the room, then that means that you, as the interpreter, will also be outside of the room waiting. And so you will have to let the patient know that you will return when the provider returns. And usually what we do is we just stand right outside the door so that we are able to see that provider as they are coming in. A lot of times what happens is this is fine. This is where we stand. Sometimes, occasionally, we will have sort of an MA or a nurse or someone who is a little too cautious, and they don't want us standing there for a couple of reasons. It might be because the hall is so small, they don't want anyone standing in halls because of safety rules. In that case, you're going to ask where is the best place for you to stand so that you can still see the room and be aware when the provider comes. Sometimes I have had very rarely a situation where I have someone tell me because of HIPAA I cannot stand there. That's fine. We are not going to sort of argue with them to say, hey, I'm a professional, I'm also bound by HIPAA. What we're going to do is ask, where's the best place that I should stand? And sometimes it's like, oh, stand over here, stand by the nurse's station. But you ask them, I understand your request, sort of with your demeanor, right? You want to let them know that you understand the request, you're willing to abide by it, but you still have a job that you need to do. So where's the best place, or what do they recommend, right? But like I said, that happens very rarely. All right. Here on number 4 in the presentation, you see that what if the provider wants to step out while you do a site translation? Sometimes you may be in a situation where the provider will say something like, here's the information about what we just talked about, and they'll print something out. And then they'll say, I'm going to go get the nurse, and she's going to come back and give you your next appointment, or I'm going to go get the nurse and she's going to come back with the vaccine, with the flu shot or something like that. And they'll want the interpreter to stay and read that information because it's in English to the patient while they step outside and go get the nurse or whatever. We are not allowed to be alone with patients. So what you will have to let the provider know is that you cannot stay alone with the patient. You cannot remain alone with the patient. This is part of our protocols in our code of ethics. This is also for safety reasons and for privacy reasons. You can say it in this way. This is how I usually say it. The interpreter will gladly read the information for the patient when there is a provider present. While there is no provider, the interpreter is not allowed to remain alone with the patient. So again, sometimes, actually not again, I don't know if I've said this already, but because a lot of healthcare providers, or just a lot of individuals, are not familiar with how interpreters work because it's a new profession, but also because they've never needed an interpreter themselves, it is our responsibility to understand what our scope is, even when folks who are not familiar with our scope tell us to do things that are not okay for us to do. We're the ones that need to make that determination. Even if it's a doctor, and I may have already mentioned this, that sometimes we have trouble saying no to doctors, or we feel like we have to do what doctors do because we perceive them higher in a hierarchy of whether it be social or in healthcare, in a healthcare environment. But again, we are responsible for ourselves and responsible for abiding by our code of ethics, by our protocols, and our professional boundaries. So we should be okay, have that confidence that you heard me mention at the beginning, to say, and I cannot do this, I can do that, etc. Okay, so let's say that the provider is now examining the patient. The examination is going to begin. When it comes to positioning, again, the position, you're going to be on the side of the patient, not in the middle, making sure that you are in a spot where you are allowing the patient and provider to have direct eye contact and direct communication. Now, that's going to vary because, as you see in the picture here, the rooms are going to be different, and what is happening in a room is going to also affect that. So what we need to do, the correct spot for us is the least intrusive spot, the least intrusive position. Now, what you should know is that sometimes you will have to move, right? So, for example, as you watch the video, you will see that the interpreter is sitting on a chair. And then when the provider asks the patient to lay down so that he can examine him, then that's when you see the interpreter will stand up and have to move from where she is sitting from. So again, least intrusive, but again, you also want to allow those providers to be able to do their work. And I say this because in a lot of the literature and a lot of the textbooks and things like that you will read, and a lot of the training materials, the interpreter is told you are to stand slightly behind the patient, off to the side, and on the side of the patient. But you have to use your critical thinking skills, and that is not going to always work because of the environment that we find ourselves in. So if someone needs us to move, we can't just say, well, this is where my protocol tells me I need to stand and I'm not moving. That's not how it works, right?